impairment disease.
Okay. Thank you, Chairpersons. My topic is a clinical study of iPS cell therapy for RP impaired disease. This is our COI. Although there is no established treatment for retinal degenerative disease caused by RP degeneration, we call this RP impaired disease. Transplantation of allogeneic iPS cell derived RP may be a curative treatment. Up to now, we have conducted several clinical studies in different graft formulations. The first one was RPC transplantation. This was our first in-human RP cell therapy in all medical fields. And the advantage of iPS transplantation is reliability. But disadvantage was intense surgical invasions. So next, we have tried RP cell suspension transplantation. The advantage of cell suspension transplantation is minimal surgical invasion, but we couldn't control the grafted cell under the retina, not at all. So this is a big problem. Then we have developed a new graft formulation, that is RP strips. This method combines the advantage of RP sheet and RP suspension, which means reliable transplantation and minimal surgical invasion. What is RP strips? RP strips are formed in narrow grooves in 2-day cultures. And these RP strips can be ejected with a 31-gauge cannula. This slide shows a preclinical study. In vitro setting, RP strips spread out on the plate and form a single RP layer. And in vivo setting, under the retina of the rat, a single RP layer with light polarity is formed. We performed the RP strip transplantation 2022. After creating a retinal bleb, iPS cell derived RP strips were transplanted under the retina using a 31-gauge cannula. You can see the subretinally injected RP strips. We treated 3 patients. Case 1 was a dry AMD, and case 2, case 3 were Mertic-associated retinitis pigmentosa. No serious adverse event occurred in all 3 cases. But in case 1, suspected immune rejection was occurred, but this was controlled by additional steroid and immunosuppressant administration. And in case 3, macular edema associated with ARM occurred, but edema was resolved by subtenon steroid injections. And POCT analysis revealed that this ARM was not originated from grafted cells. I'll show the time course of case 2. This is a pre-transplantation. And I transplanted 2 strips, this area. So, okay, so 1 month, 3 months, 6 months, 9 months, 1 year. As you can see, the transplanted RP was visible immediately after transplantation, and the area of engrafted RP gradually expanded. In OCT images, you can see the cross-section of RP strips. In 6 months, 9 months, 1 year, as you can see, subretinally transplanted RP strips expanded their engraftment area into a thin and flat area, likely a single cell layer. The primary endpoint was reduction of RP abnormal area by transplanted RP. The changes in window defects were analyzed using an automated evaluation program with AI. As a control zone, which means untreated zone, RP abnormal area unchanged or tended to increase. In contrast, at the treated zone, RP abnormal area decreased, which means improved. The abnormal RP area decreased after transplantation in all 3 cases. The secondary endpoint was visual function. Most parameter was not changed, but in case 1, VFQ25 score improved remarkably. And actually, this patient says us that she can now see well in dark places, and that she can see the stars in the sky, night sky, which she couldn't see before the treatment. QOV improved in dry AMD case. This slide shows MP3 results. In case 1, retinal sensitivity within vascular arcade improved in the treated eye, but in the fellow eye, sensitivity decreased. Conclusion, iPS cell-derived RP strips were successfully transplanted subretinally in advanced RP impaired cases using a minimally invasive technique. 1 year follow-up confirmed both safety and efficacy. Thank you for your attention.
Thank you. A very novel and interesting presentation. I just have one question. Is that your cases was, I think one was ARMD and 2 cases were retinitis pigmentosa.
One case is dry AMD and the rest of 2 retinitis pigmentosa with MERTK mutation.
Okay, so how did you select the location where exactly to transplant these RP strips?
So we selected the transplanted site in where RP is gone, but photoreceptor is still alive. Donors, no, host's photoreceptors is necessary.
Yeah, I meant like the location, you know, how did you choose where exactly you want the RP strips to be transplanted?
Okay.
Like 2 were retinitis pigmentosa and 1 was ARMD. So, is it the same location in all the eyes? Or how do you choose where exactly you want the strips to be transplanted?
Okay. So, the surgical procedure is very important for a good transplantation. So the one reason is it's suitable for surgical procedures. And more important condition is, as I told, that area, RP was gone, but photoreceptor is still alive site.
Okay.
Did they have the same, do you know the mutation profile of these patients? What mutations they carried?
Sorry,
what genetic mutations were there in the patients?
In AMD?
In AMD as well as RP?
In AMD, we can identify the mutation, genetic mutation.
And in RP?
Yeah, it was mentioned in the
that
table.
that was only one
Merck
mutation? The Merck mutation?
MERTK mutation was identified in 2 cases.
Oh. And it's the same, and they were homozygous, patients were homozygous for that?
So, yeah. Yes.
Yeah.
How many strips did you transplant?
In case 1, that was the first case, so I transferred just 1 strips. And the other 2 cases, I transplanted 2 strips. Because ethical committee restricted the 1 or just 2 strips for safety. And our next clinical study, we will transplant 4 or 8 strips.
What's the length of each?
Lengths are about 2 centimeters, which include about
2 millimeters.
2 millimeters.
no.
2 centimeters.
Oh, so sorry. 2 millimeters. Yes, 2 millimeters. Sorry. Which include about 12,000 RP cells. 12, no, so 200,000 RP cells.
So how do you decide the polarization of the cells?
In the strips, it's random. But in animal experiment, after they transplanted and they engrafted, they find their own light polarities in vivo.
Thank you. Thank you very much.
Thank you.